about now is PAHO's, excuse me for the acronym, the Pan American Health Organization's one of their flagship initiatives, which is the Evidence-Informed Policy Network. And basically, the point is that it basically touches upon all the various components of a system for health. And so, in that way, it really is a catalyst for a health system, which is basically, it seeks to bring scientific evidence to the table when policymakers are making policy. So it brings in a number of activities. In the first phase of putting together this initiative, basically a team has to be built, and that team has to include members of the policymaking community as well as members of the research community, academicians, civil society, etc. So it really does bring together a number of stakeholders. It has to be resourced adequately. And then, as in a second phase, it enhances linkages between producers and users of evidence. As one of the key outputs of this EVIPNet, it leads to the commissioning, updating, and use and assessment and adapting of systematic reviews in the production of what we call policy briefs, basically a communication device to bridge the communication gap between the policymakers, folks in the Ministry of Health, and other stakeholders in the policymaking community, and the academic community, which produces the research. These are the policy's goals and objectives. Basically, effective information and knowledge systems and dissemination plans. They all support that. They all support that there be clear national and regional research agendas and policy. All support human resources, a capable research workforce. We heard much about this in various meetings that I have been participating in the global forum. Strong regulatory frameworks and structures, well-equipped research institutions, and adequate financial resources. All of those, I think, are, interestingly enough, all of those are attributes and that contribute to the establishment and strengthening of research systems for health. The point that I'd like to leave you with is that EVIPNet is a catalyst. Basically, what EVIPNet does in providing the reliable and trustworthy evidence is it touches upon all the various components of a robust system for health.